Hello, my name is Virginia, and I wanted to present my portfolio project to my crisis team in regards to Marie. I wanted to first talk about some of the risk factors that I found at the home when we went to Marie's house. First and foremost, when we arrived there, her door was open and she was crying. We could hear sobbing. So we went to the bathroom and found her in there with a bottle of pills. We also noticed around the house that the curtains were closed. There was dirty linen everywhere. There was, no food in the cupboards. The cupboards were open. There was dirty dishes in the sink with flies collecting around them. The electricity was even out. So, clearly we could tell that the client was in distress. We entered the home, we started talking to Marie, and she told us that she did not want to kill herself, and it was unclear whether or not she had taken any pills, but that she just wanted her problems for her and her family to go away. So, the first step in the, crisis intervention hybrid model. Basically, the first task is predispositioning and engaging. And this basically involves us meeting with the client for the first time, seeing the client for the first time, engaging with them for the first time. Oftentimes, the client does not want to talk or is out of control, and they might not even be aware of our presence. In this situation, Marie was aware of our presence. Um, she engaged in such a way that she was actually receptive to the intervention. We approached her slowly and calmly. We introduced ourselves to her and stated our name. And we also used open-ended questions and basic listening skills just to kind of find out what was going on in her life that led her to this crisis. We clarified our intentions with her, that we wanted to get her help without escalating the situation. The second task involves problem exploration, which basically the first step in this is to define the problem, which there are many problems in this scenario. You are looking at a client that is being abused by her husband, has lost custody of her children, has a history of depression and suicidal ideations. These are all problems in this scenario for the client. Sometimes this task can be difficult in a chaotic situation, but we were able to escalate the situation and get Marie to kind of agree to go get help. The third task in the model of in this model is providing support. So here you want to communicate concern for the client by telling them that we can provide them resources. We can provide them food, water, shelter. If we can't physically provide those, we can locate resources for her that can. You want to kind of ask the client what her primary support system is, to see, kind of gauge if she has any support. The fourth task in the model is examining alternatives. Oftentimes, clients think that there's no option for them, there's no way out. And Marie, although she didn't really want to kill herself, she just really wanted somebody to listen to her. Oftentimes, clients feel that they have no way out. So, you want to try and brainstorm different ideas to help get her, support and things of that nature. You want to ask them questions such as like, what have you done in the past that has helped you with this situation? These are all things that we asked her when trying to help provide her with resources. The fifth task is planning in order to reestablish control, and this basically just identifies resources for immediate support. So resources like the Samaritan House and things of that nature for her, and inpatient psychiatric help. We want to help the client develop different coping mechanisms. And we want to help develop a plan for them that's going to allow the client to basically establish autonomy and become mobile again, I guess you would say, to help them restore them to equilibrium. The sixth task involves obtaining commitment from the client. If the fifth task, planning in order to reestablish control, was done effectively, then this task should be rather easy. So that way, you can go ahead and get commitment from the client without having to force it. Commitment to, basically have her, admitted to an inpatient psychiatric facility without having to put a TDO on her. The seventh task includes follow up, and that basically can be a matter of days, hours, etc., weeks. Case managers can follow up, we can follow up, CIT officers can follow up. And it basically just reinforces my job as a crisis worker and supporting the client so that they know we do still care about them. Marie, I think, has a very bright future, and I think that if she takes advantage of these resources and gets back into therapy and on her medication, she can help, regain custody of her children, and live the life that she wants to live. So that's the portfolio project video submission part. I hope you enjoyed.